So war taught me how to invent solutions. That other patient who had a proximal humerus fracture and proximal scapula fractures, and he has no scapular spine, he had no deltoid, 80% of the trapezius was
Yeah.
missing. It was like I read literature. There was nothing like this in literature, not even in sarcoma literature. So I had to invent stuff. Okay, so
Yeah.
war taught me how to invent solutions, and believe me, Ken, all these solutions I invented are based on the basics I learned from this fellowship. I would have never reconstructed any mutilated shoulder without taking this fellowship.
Welcome to Inside the Shoulder. I'm Kenneth Cutbush, and I'm joined today by Dr. Mohammad Jomaa. Welcome, Jomaa. How are you?
Thank you. Thank you, Ken. I'm good, thank you.
Can you say your name in your native language for me?
Yes, so it is Mohammad Jomaa.
Wonderful.
Thanks.
So, where are you today?
So I'm in Beirut. Uh, I've booked an hotel room to get everything calm and steady and having a steady internet connection. And I've booked a panoramic view of the Mediterranean. So
Yeah, for everyone's
that's the
benefit.
view.
You're so good to us.
Yeah, yeah, yeah.
Fantastic. And we'll see the sunrise
And
soon. What time is it for
yeah,
you right now?
it's 6 a.m. in the morning.
Wonderful. All right, Mohammed. So for everyone listening, you were my fellow a few years back, and you're now back in Lebanon, in Beirut, and you're now the first dedicated shoulder surgeon to go back to Lebanon, aren't you, in terms of what you do there?
Yep.
How is it back in Lebanon now?
It has been fantastic. It's like coming from a general orthopedic background to a very subspecialized shoulder domain, and so far so good. I like it. It's fantastic.
And it's quite unusual in Lebanon for an orthopedic surgeon to be so subspecialized, isn't it?
Exactly. So there is a general theme in Lebanon that an orthopedic surgeon does everything. So an orthopedic surgeon would be expected to do spine surgery, knee surgery, even head and neck surgery sometimes. So it's not habitual for an orthopedic surgeon to be focusing on one area of the body. That's correct.
And what are you leading up now? You're leading up a special unit in Lebanon and Beirut?
Yes, so I'm leading a shoulder and thoracic outlet unit in Clemenceau Medical Center in Beirut. And uh, it takes a bit of effort to have everything sorted out, like imaging department, physiotherapy department, and everything. I'm trying to compile shoulder knowledge and to transmit shoulder knowledge to all these departments so we can have the best patient care.
So good. All right. So where did your journey start? Where were you born, Jomaa? Tell everyone.
So I was born in the heart of Beirut, and I've attended Beirut schools. I have always been like a straight A student from the start. So my
Super
passion
nerd, like the
was,
rest of us.
yeah, exactly. So I liked mathematics and physics actually, not biology first. So
Mhm.
I always envisioned myself as being an engineer, a future engineer. Then comes high school, and with high school, uh, there are pathways in Lebanon, high school pathways. So there is one specific pathway which is totally focused on mathematics and physics with zero biology. We don't have any class in biology, so I chose that pathway. And I actually excelled at that pathway. I scored the top rank in the official Lebanese examinations in Lebanon. So at the summer vacation of that year, like transitioning between the 12th grade and the first year college, I made a very stunning shift to medicine. So
What happened?
actually, it's like I came to a conclusion that there is no. I came to a very naive conclusion, so I don't have any that opinion anymore. So at that moment, at that time, I came to a naive opinion that engineering does not have innovation. I cannot innovate in engineering. I cannot. Uh, uh, it's like limited. You know how the naive opinion now with AI and everything. Back then, when I chose medicine, um I had a thought that engineering is limited and I cannot invent anything else in engineering. I cannot innovate, so I chose the more complicated discipline, which is medicine. So it's just a quest for complexity and a quest for something hard. It's like I just felt that engineering is super easy and everybody does engineering, so I don't want to be like another somebody. So I went straight to medicine. That's how I. In Lebanon, when you are like a top ranker, you either do medicine or you do engineering or you become a lawyer. So that's the top three. That's the way the culture runs here. So I ended up choosing medicine because I thought at the time that it's more complex and it's harder than the rest of the disciplines.
And what's your family background? What do your parents do?
So my father is in the medical field, and my mother is in the medical field as well, and both of them have like raised me to love medicine as well. So medicine has always been part of my family, my bigger family. So actually, turning into engineering was something they were they did not expect. Okay, but I made the last minute turn to be a doctor again. So
Were they happy about that?
yeah, like it was it was the most perfect decision I have ever made. Like becoming a doctor, I'm really enjoying it, Ken. I'm
Yeah.
fixing I'm fixing shoulders, and by fixing shoulders, we are fixing lives, right? We are saving careers, and we are fixing lives, and we
Yeah.
are making patients sleep again. So it's really rewarding for me right now.
Yes, it's just terribly rewarding for me. People do ask me why I went from neurosurgery. Well, I tell people I've been doing neurosurgery and now doing shoulders, and a lot of people are quite surprised by that because they think, "Oh, neurosurgery would be so exciting." But for me, it's the same thing. In with the shoulders, people don't think about their shoulder, but yet when their shoulder's bad, they can't sleep, they can't work, they can't go to the gym, they have trouble looking after their kids, and we can invariably fix it and give them back their life, and it's pretty cool.
Exactly, exactly. It is rewarding. And in terms of innovation, it holds lots of innovation. I mean, the decision making in shoulder surgery is probably the most exciting decision making process in all of medicine.
Yeah.
I really think that.
So now you came to Australia. English, of course, it's very difficult for people to come to Australia to work in medicine because they have to get such a good score in their English test, the IELTS, isn't it?
Yes.
Your native languages, tell us about them, because I always find this fascinating.
Yeah. So my first language is Arabic. My second language is French. I have studied my medical school in French, so everything was French, including orthopedics. So orthopedics was French as well, and uh, English was my third language. So uh, I've always cared about English because the whole world is English and is speaking English, and English is the way to go. And um, we are not in colonial France anymore, so we have to focus more on English. So I have focused, and the Lebanese university focused on English early on. So I've compiled some knowledge in English, and I have been tested using the IELTS. And I scored. I believe the APRA wanted like 7 on the 4 categories,
Mhm.
and I barely made it in the writing section. Like, It's funny because I'm writing articles now, and I've written good articles in fellowship.
Yeah. And you write really well.
Thanks, thanks. But in the IELTS examination, I barely made this 7 out of 9 on the writing section. So I'm lucky to have that.
So then, why orthopedics?
So the same quest for complex and interesting stuff. So I have finished medical school, and in Lebanon, the Lebanese university follows the French curriculum. It doesn't follow the American or the British or the Australian or any other curriculum. So we have 1 year only of pre-med, and we have a lot. Like we head for the real medicine stuff early on, from the second year onward. And we have an entrance exam to the second year. That's where most of first year students fail and uh, continue biology or biochemistry or whatever. And then those who succeed continue in medicine. Then at the seventh year, we have another examination, the specialty examination. That's where we choose what part of what specialty we want. So during my last 2 years of medical schools, the sixth and the seventh year, that's equivalent to Med 3 and Med 4. I was an intern rotating in hospitals. That's where I started swapping my medicine rotations with surgery rotations. You know, uh, don't get me wrong, I like medicine, I like cardiology, I like reading EKGs and all these sorts of stuff. I like thinking about like blood pressure stuff and ejection fractions and all these sorts of stuff. But back then, something drew me into surgery. Out of nowhere, I was like, without thinking about it, I was taking the most of my rotations in surgery, and I was swapping them with my friends who wanted to do medicine. So I ended up attending the operating room more often than others, and I hooked up to surgery. So I liked surgery. For orthopedics, I same stuff. The looking for complex stuff and interesting stuff. I like the idea that surgeons, as in general, fix stuff and look at organs when they fix them. It's different to cardiology, right? Like cardiologists, a cardiologist would fix heart issues all his life without seeing one single heart in all his life, right? So
Yep.
that's different to surgery. Like we look at the tumor, we look at the broken bone, um, we look at the entrapment site. So it's really fascinating, like to see the pathology and to get to fix the pathology. And um, I've always visioned orthopedics as the most fixative or the most reparative kind of surgery. So general surgeons are doing a great work fixing gut stuff and intestinal stuff, but and neurosurgeons get to fix lots of brains and spinal cords, but it seems that they do not reach 100% satisfaction from patients, right? But orthopedics always get like the 100% satisfaction most of the time. So
Yep.
I like the idea that it's more satisfying, like I get more satisfying results doing orthopedics, so I chose orthopedics.
And what was it like getting into orthopedic training in Lebanon? How hard was that? What did you have to do?
It's super hard. So first of all, the orthopedic program is the most competitive program in Lebanese university. So we make a special entrance exam to get the specialty we want, and we we start choosing the specialties from the first rank and downward. So the first rank, let's say, chooses plastic surgery. The second rank chooses like maxillofacial surgery. And orthopedic surgery, the last one to choose orthopedic surgery is like rank 15 out of 100 or so. So I was rank 14 during that examination, and I got the orthopedic program.
So you're saying that it's one of the most competitive ones, orthopedics.
Yeah, yeah, yeah.
So what do you mean by ranking? How does the ranking happen?
So we make at the end of the 7th year or the 2nd year of internship. So we finished medical school. We do an entrance exam to the specialties. Okay. So it's a unifying exam. Everybody gets that exam, and a class of 100 students would sit for the same exam, and then according to the grade, the ranking happens. The very first, like every grade gets like each student chooses whatever he wants, starting from the first grade to the 100th grade. So the first student usually chooses like dermatology or plastic surgery or maxillofacial surgery. These are the hot stuff here in Lebanon.
Yeah, right.
So 3 or 4 students get to choose orthopedic surgery. Sometimes, if one is lucky, orthopedic surgery stays till like rank 30 or rank 35 out of 100. But most of the time, the last one to choose orthopedics would be like rank 20 or so out of 100.
Yeah, right.
So 5 students, 4 to 5 students would choose orthopedics, and these 4 to 5 students would be the top 20% of the cohort.
Yeah, right.
So I ranked back then rank 14 out of 100, and I chose surgery without any flicker of an eye, like straight ahead, orthopedic surgery. Some choose general surgery. Yeah, some choose general surgery and later on change their mind into orthopedics.
Yeah.
I chose orthopedic surgery straight away.
What was the training program like in Lebanon? What do you have to do?
So it's a 5-year program. The first year is a general surgery. Is general surgery. So we get to rotate to general surgery, neurosurgery, plastic surgery, vascular surgery, even gynecology, and all this stuff. That's the first year. From the second year onward, it's pure orthopedics. So as you saw, Ken, we get into action fast. Like in medicine, we don't do 3 years of pre-med. We just do 1 year and get straight to
Sure
medicine
do.
stuff. And in orthopedics as well, we do only 1 year of general surgery and we move straight to orthopedics. So uh, then comes 4 years of residency. Okay, so the first one included. So the general surgery year is included. So it's counted as like after the first year, it's counted second year residency, third year residency until the 5th year residency. And we get to rotate in the Lebanese university. We do not have one hospital. We get to rotate to a different hospital every 6 months. So during the 5 years, we have the chance to rotate to 10 different hospitals, 10 different orthopedic programs, 10 different mentors, and 10 different departments. So this is an added value here in Lebanon, I believe. If you make a program director mad, you if you make the program director mad, you don't have to be nervous or anything, because in 6 months you will leave to a different one. So that's one of the drawbacks of this system, is that once we get to know the program directors and once we get to handle stuff in OR, like when get the trust we need to handle stuff in the OR, we get to move to another location. So this is one of the drawbacks. But in my case, I chose to stay in the same hospital twice. So I spent 1 whole year with different with some program directors, and that's the second year of my training. That's when I got introduced to arthroscopy, to advanced shoulder and knee arthroscopy. And in my 4th year of training, that's when I joined the military, so the Central Military Hospital, and got to work with all these trauma work. So that's how it is.
Tell me, what are the hours like as a training registrar in Lebanon?
So a resident does not have any hours outside the hospital. So the hospital is our first home, and our mom's home is our second home. So uh, it's like 24 hour shifts, 48-hour shifts, even 72-hour shifts is very habitual for Lebanese residents. So we would split the hours between us, and I would get, let's say, 72 hours, sometimes even 4 straight days in the same uh, in the same shift. So it's very habitual to have long shifts, long hours, endless calls, endless visits to the ER, endless starting surgical cases, and that's how it is. So there's no post call in orthopedics. We don't have post call and go home. No, we continue the day till the end of the day, and then we go home.
So, how much do you sleep when you're on call doing 4 days in a row?
So during 4 days, we don't get much sleep. So I would be paged in the first night. Like if I'm lucky, I would get 1 or 2 calls only during the night. But if I'm not that lucky, I would be paged all the hours of the night. So there is no rule for that. And uh, during this like 72-hour shift, I would cover ER, I would cover OR, I would cover the surgery floor. There's no such uh, there's no job description in orthopedics, Ken, right? There's no job description. So you sign a paper for a job description that says 8 hours per day, this and that, this and that. But we all know that an orthopedic resident never sleeps, and an orthopedic resident always answers calls, and that there is shortage. There's always shortage in orthopedic trainees and orthopedic residents, right? Uh, so the whole hospital runs on 1 or 2, probably in the best case scenario, 3 orthopedic residents, and we have to split work among the 3 of us. So just imagine 30 days over 3, that's 10 days in the hospital. And actually, when you are a senior resident, you get more calls. So in the fourth and fifth year of my residency, I used to be on call like 30 days a month. So just answering calls and going to ER whenever I'm needed.
So, basically on call every day,
Yeah, yeah,
and having to go into the hospital every day.
yes, of course.
All right.
Including
Wow.
Sundays. Yeah,
Yeah.
including Sundays, including holidays. There are no holidays in orthopedics. We all know that. There are no Sundays. Uh, I would rotate. I would do the case. Let's say on Thursday, I will keep visiting the case. Friday, Saturday, Sunday. Probably discharge the case on Sunday. That's very habitual. This is very normal. Doing casts over the weekend. This is very, very habitual. And whenever the junior resident is not strong enough or does not get enough trust, there's more burden on the senior resident to do stuff using his own hands. So I would never be confident in handling a cast to a PGY1 or PGY2 resident over the weekend, especially if the cast is for a small kid. So I would I would come and I would cut my vacation and come and do the cast and then go back. And most of the time I would not be even in Beirut. I would be like 3 hours away. So I would drive 3 hours, do the cast, and drive 3 hours back to to continue my vacation. It's very habitual. Those were
Really?
the days, my friend.
So, Jomaa, you came to Australia. talk me through that. What attracted you to coming to Australia and doing a fellowship in Australia?
So during my like after I finished residency, I thought that shoulder surgery is something lacking in the country. I mean, I got fascinated about shoulders and knees since PGY2, since I was a second year resident. And then Bassem comes in the third year. I spent 2 days with Bassem, assisting him in surgeries and stuff. And we had lots of conversations. I saw him examining patients.
Mhm.
And then Bassem told me, you shouldn't do knee surgery. You should be a shoulder surgeon. And it was like I can do knees as well. And he told me, no, just do shoulders. Focus on shoulders. I didn't, like, I was young, I didn't comprehend what he meant back then. Later on, I totally understood his position. So I put shoulder surgery since PGY3 onward. So PGY3, PGY4, PGY5, I was favoring shoulder surgeries. I was scrubbing in shoulder surgeries. I was doing shoulder cases. And then I thought I need something like a very strong, a very tough program in shoulder surgery. So I searched and searched, and I found your program actually listed under ISACOS, I believe.
Mm-hmm.
Your program is ISACOS.
Yep.
Yeah, so I found it on the ISACOS website. And what fascinated me is that the description, like you had a really great description of the arthroscopic letarge. I believe you focused on arthroscopic letarge in the description.
Oh, right.
I thought to myself, like, arthroscopic letarge? Nobody does arthroscopic letarge in Lebanon. Okay, let me see. And I opened your website, and I opened Ashish's website, and I thought these guys are doing really great stuff back there. So I ended up like applying for the program and waiting for your response, and the response came. It didn't came quickly. It took a lot of time to come, and when it came, I applied. We had a very brief interview, and actually the interview was directly after like the Beirut explosion. Remember Beirut
I remember
explosion
that.
of 20?
Yeah.
Yeah.
Down at the waterfront, down at the harbour.
Exactly. So 75% of the interview was talking about the Beirut explosion. So, and I've had a whole like I prepared answers for everything. You didn't ask me anything of what I prepared. It's just chit-chatting about Beirut explosion. So that's how the interview worked. And then came the lockdown. So the Australian lockdown. I heard that the Brisbane airport wouldn't allow more than 50 airplanes per day or per week, and I couldn't find tickets. So you know the story. So I put my name on any flight to Australia, whatever the flight is. So one day they called me and they told me, you have 5 hours to prepare yourself for departure. We are departing in 5 hours. And I was like 3 hours away from Beirut. I was vacating somewhere with my fiance. So I knocked on the door of my fiance. I told her we have exactly 3 hours to get dressed, to prepare the bags and everything, and to go over the paperwork and the passports and everything. We are departing in 3 hours, and that's the notice we had. Like we had the same day notice that the departure is going to be 5 hours away. So we prepared ourselves in a hurry and we went there. We were surprised that we were the only ones on the airplane. It was like a commercial airplane. They were transiting fruits or something. I cannot recall. And we were the only ones on the airplane. So we had a whole crew serving only the two of us. And that's better than private flights, Ken. That's better than private flights.
Better than the private jet, was it?
Having like a jumbo jet uh, to our service, and it was like 5-star airlines. So it was like I believe Emirates or something like that.
Mhm.
And we had a whole jumbo plane to ourselves. We used like to sleep one night, like a few hours in the we used to shift places all the time in the airplane. It was hilarious. It was like fantastic. And we ran over hurricanes. The flight back then was not in the best weather conditions, but we had to do it anyway because that's our only chance to get to Australia. We would have waited like 2 more months to get another flight. So I had to take that chance. So whatever the weather condition was, whatever the risks, whatever the flight conditions were, I had to take that flight. So that's how it went.
And then got here. So I remember our interview. What I remember about the interview was your passion. You just had this single-minded passion to be a shoulder surgeon, and then that was all I needed to know. And then I just needed to know that you're actually a relatable person, that you could on a personal level that we would click. So that was where I was coming from. I could see the passion. You just had this drive and passion to be a shoulder surgeon, which is so exciting when you're looking for fellows to come and work with you. That passion, that excitement for what you're doing is everything.
That's the key word, Ken. Like you are exposing the single most thing that interests you is the passion in the eyes of the
Mm.
candidate to be a shoulder surgeon, and the plan to be a shoulder surgeon, in fact. So you won't be training someone who is here just to have fun and go home and expose himself to some shoulder surgery and go back home to focus on something else. You are here to build shoulder surgeons, and you've really built a shoulder surgeon out of me, Ken. It's like going from a very like I went I went to your program. Like I thought I knew everything about shoulders until I got to the very first day in your program. That's where I realized that I know nothing about shoulders. It's a whole different world. It's a different level of
Mm.
thinking, a different level of templating, and a different level of considering cases. So yeah, that was fascinating.
Now, you mentioned one of your mentors, Bassam. That's Bassam El Hassan. Bassam's now chief of surgery at Harvard University, I think, isn't he?
Yes.
And you keep in contact with him, don't you? Because
Yeah, of
he's
course.
tremendously inspirational.
He's inspirational, and he is very humble. He's one of the um most humble persons I know.
Mm.
He would not show that he knows way more than anybody else,
Yeah, but he
uh,
does.
especially us. Like he would talk to me as if I'm at his level,
Mhm.
uh, and I really like that about him. He's so humble. He would explain the case for me in a very simple way. He does not make things complicated, and
Mhm.
he appreciates my ideas. I like put an idea, he likes it, he endorses it, and later on he tells me go publish it. So I like the idea of like this is you had this trait, Ken, right? You have this trait. You do not impose your ideas. You accept uh, the ideas of young fellows in a very humble way. You do not laugh at ideas. You would consider you would politely correct the ideas without telling a fellow that your idea is stupid, right? Like you straighten ideas in a very humble, in a very polite way, in a very great way. So I
Thank you.
think that's the difference between a mentor, a leader, and a program director. Like you are a program director, but you are a leader as well, and you are a mentor as well. So that's what mentorship is about.
Now, Bassam, you're telling me, is originally from Lebanon, so you come in contact
Yes.
with him at he still goes back and does work pro bono in Lebanon, doesn't he?
Yeah. So I contact with him. Like most of my cases, I communicate most of my cases with him over
Mm-hmm.
WhatsApp, over the
Yeah.
phone,
Yeah.
over by emails. And when he comes to Lebanon, I get to see him. I have a case, like he's coming at the end of next month. I have a case which I'm waiting for his return to see the case
Mm-hmm.
together. So
All right.
we are arranging stuff. Yep.
Because you mentioned coming to Australia and seeing shoulders at another level, but then you have then gone back to Lebanon, to Beirut, and you've gone to another level because we have this WhatsApp group with all the fellows on, and you put cases up that just blow my mind. And these are cases from the war, the men that have been mutilated by the military exposure, and you're taking these cases on and then reconstructing them. The cases you show me are just out of this. It's just so complex and so difficult to deal with.
So Ken, the fellowship, taught me bits and pieces, like the pyeloplasty you do, right? The pyeloplasty
Mm-hmm.
that you do with
Mm-hmm.
reverse shoulder replacement. I would have never done that case of scapulohumeral fusion and tendon transfers
Mm-hmm.
without having the courage to work at the base of the glenoid, like under the glenoid at the pillar
Yeah.
level. So this is one piece that I learned in fellowship, which I implemented in my new work. So I got pieces from you, pieces from Ashish, and pieces from arthroscopy, pieces from arthroplasty. Like everything I saw, I implemented in this technique. And I've seen tendon transfer cases with both of you. I've seen lots of pec major transfers for scapular winging cases. So I didn't specifically see the triple transfers for trapezius palsy, but
Mm-hmm.
the fellowship puts you in a path where you can do it, Like it puts you in the path of you can, like once you know the basics, you can do anything. So I knew the base. I learned the basics with you guys, and I went on to try new techniques that I learn from other persons, that I read, that I watch, and these other cases would be very simple because I know the basics from you. Okay, so the basics are more important than the techniques themselves. The basics are the most important, and what works, what doesn't work, how to deal with tissues, how to deal with uh, shoulder components. That's the basic stuff, you know, like releasing the triceps, for example. This is one of the
Mm-hmm.
pitfalls. Like you release the biceps. Some people in my country get amazed that the biceps is getting released every time I do a reverse. It's like
Mm-hmm.
what you are doing to the triceps.
Mm-hmm.
And I tell them, I know what you do not know. I know the end of the tunnel. Don't worry. And when I release part of the anterior deltoid, the
Mm-hmm.
deltoid reflection,
Yeah. Yeah.
I tend to do the deltoid reflection now
Mm-hmm.
to make exposure easier for me. And I always get these like eyebrows raising. What are you doing to the deltoid? What are you doing to the pec? What are you doing to the triceps? What? It's like it's like it's these are like hidden secrets which others won't understand easily. And I've seen
Yeah.
the end of the tunnel. I've seen patients raising their arm
Yeah.
directly after a reverse where you had deltoid reflection. So I know the end of the tunnel. So I always reassure people.
To release the deltoid, preserve it so it doesn't get bruised and damaged and torn, and then to put back a pristine deltoid, that then is so much more useful to the patient long term than one that has been damaged by too much retraction because you can't get the exposure you need to get into the operation properly. Yeah,
Exactly.
these are things you learn. So yeah, it is part of the journey. And I remember you were at one of our Zoom education meetings with one of the fellows talking, and I think at the time the war was going on in Lebanon, and you were telling me that it was okay. That was only the south of Lebanon. it was really, it's so different coming from Australia where that doesn't happen. It's really hard to understand or even comprehend.
exactly. The last time Australia was engaged in war was in Second or First World War. So I wouldn't assume an Australian to understand the burden of war, even where we are not in direct, even if we were not directly in the place where the action is happening. Okay. For example, let me give you an example. I had a massive rotator cuff patient, okay, who was 50 years old, I believe 52 years old, and he was repairable at the time where I see the MRI. He was repairable. Like there was no fatty infiltration.
Mm-hmm.
The supraspinatus, infraspinatus were had good trophicity. There was no atrophy in them. There was no
Mm-hmm.
fatty infiltration. Nothing. The retraction was okay. It was retracted to the glenoid level, but uh, I believe it was elastic because it was acute, it was post-traumatic, and I could have repaired it. And by the time I saw the patient, so the patient was in a conflict zone, and because I did not see the patient in time, I saw him like months after. I repeated the MRI, and it was no way repairable. So I had to seek another like tendon transfer. So that's one of the drawbacks of war. Even if we are not engaged in war, we are receiving patients from war zone who, uh, like that other patient who had a proximal humerus fracture and proximal scapula fractures, and he has no scapular spine, he had no deltoid, 80% of the trapezius was
Yeah.
missing. It was like I read literature. There was nothing like this in literature, not even
Mm.
in sarcoma literature. Like
Mm.
I would expect it to see something, some reconstruction articles in sarcoma literature. I didn't find anything, so I had to invent stuff. Okay, so
Yeah.
war taught me how to invent solutions, and believe me, Ken, all these solutions I invented are based on the basics I learned from this fellowship. I would have
Mm.
never reconstructed any mutilated shoulder without taking this fellowship. Not even all my years in trauma. Like trauma is another story. Trauma is
Yep.
very different to shoulder surgery.
Mm.
Um, sarcoma is very different to sarcoma work is very different to shoulder surgery. But when you learn the basics from shoulder surgery, you can do any difficult mutilated case, any difficult sarcoma case. You know your planes, you know what works, what doesn't work. You know the osteology of the shoulder, you know the muscles, every bit and piece of the muscles. So uh, you know the techniques. I've seen lots and lots of pitfalls and techniques with you guys, and I applied everything, and I've been able to reconstruct lots of mutilated shoulders. The
Mm.
one the one you saw is just one of many, Ken. That's
Yeah.
like epitome.
I agree with Bassam. You should be publishing them because other people don't have this experience. But isn't it amazing? You know, with your education and training, you're now the guy back in Lebanon who can actually change these people's lives. Pretty amazing thing to think of, isn't it?
Yeah, I mean, lots of surgeons wouldn't have touched that patient.
No, without the training, how can you?
Yeah, yeah, exactly, exactly. And these patients come to me very desperate, and they come to me with a mentality that I'm another opinion. Like everybody they saw, they tell them that there's nothing that we can do, and they come to me and trying to and anticipating to hear that I can't handle it. Okay,
Mm.
and there's also the age factor. I'm like young, younger than most of those who reject to work with them, and I actually get some patients to question whether I have the experience to do it or not, and that's fair enough. Like I get this all the time. One of my patients, I believe he emailed you concerning something, right, Ken?
Yeah, I'd forgotten about that. Yes, he wanted to check that you had actually done a fellowship in Australia. He was very
Exactly,
skeptical of
exactly.
your of your You felt you were just making claims.
Yeah, exactly. So that particular patient had a posterior labral tear, and it was like a simple tear.
Yeah.
But he was very anxious about it. He saw 20 orthopedic surgeons in
Yeah.
Lebanon,
Hmm.
and I told him that everybody told him that it's probably you will get this complication and that complication, and they talked with him in complications. I was the only one who didn't talk to him with complications. Like I told him that this is an easy labral tear.
Yeah.
Like it can be done.
Yeah.
No worries.
I remember emailing him back and telling him that he was in excellent hands with you.
Thank you, Ken. Thanks for that.
Hmm.
I did it. I did the case after all, and he was amazing. Now I'm treating his mom for frozen shoulder. So
Yes.
it's rewarding. Like shoulder surgery is differs from spine surgery by the fact that a patient would present, like when a patient presents to you after you fix his right shoulder for left shoulder issues, that's the best thing that you can think of. Like it's very rewarding. Like he's trusting me with his other shoulder. That's different than the spine. So a patient does not have another spine to to come to you with, right?
Yeah.
He
Yes.
has one spine. When the patient comes in with complaints about the other shoulder, months after I do his contralateral shoulder, okay, this is very satisfying to me. This is one of the reasons I chose shoulder surgery as well. And most of my patients are satisfied now. I'm applying the techniques I learned in Brisbane. Like I'm not
Mhm.
doing anything else, and most of them are satisfied. Most of them are happy. Most of them are back to work, back to sports, and most of them I'm getting a lot of like family referrals. Like they are coming in back in for their other shoulders. They are sending their family members to me. And what's funny about it is that I advertise myself as a shoulder surgeon and I tell them that I'm a shoulder surgeon. I do their shoulder surgery. Then somebody sends his sister for knee issues or for
For your
spine
knee.
issues. Or yeah, it's hilarious. Like they forget that I told them that I'm a shoulder surgeon, and
Yeah.
yeah, that's the mentality here.
I would get someone a day ring up and they talk to my staff and they say, look, we really trust Ken and I've got a knee problem. I know he doesn't do that, but who would he go to if I had to have my knee fixed? And that's probably a couple of times a day. It's it is
Yeah,
something, that people do learn to trust you when you deal with
trust.
them
Yeah, yeah.
straightforwardly and tell them exactly what's going on, tell them all the problems and walk them through it. And they do learn to trust you. It's very important to them, that sense of trust.
Exactly, exactly. It's the trust issue is very, very important. I have a patient who had an infraspinatus tear. It was a partial infraspinatus tear with stage 3 fatty atrophy. I don't know how that happened,
Hmm.
but it happened. It was partial infraspinatus with stage 3 fatty atrophy. So I repaired it and he went back to gym and he was very satisfied and everything. And then he came back to me with a lateral collateral ligament in the knee, lateral collateral
Yeah.
ligament sprain. And he told me he doesn't want to do it with anybody else and I have to do it, and he pushed me to do his knee as well. So I did his knee. I ended up doing
Hmm.
his knee, accompanied by a knee surgeon, of course. But the trust issue it's fascinating. It's like
Yeah.
it's amazing. It's amazing when patients trust you.
Yep. Sure is. So now, Jomaa, what has life got in store for you? What's your next challenge? You've all these challenges you've undertaken. What's the next one?
I'm in a journey where I want really to push shoulder surgery forward in Lebanon. Okay, there are a lot of things to do. Okay, and lately I've been engaged in thoracic outlet stuff as well. So
Hmm.
I learned how to do supraclavicular decompressions, thoracic outlet decompressions. These are not as rewarding as shoulder surgery. I understand, Ken. So shoulder surgery is way more rewarding than these. but I built a fascination about this. I learned how to do it. I saw others doing them, and I'm doing them now myself. And uh, I have good results so far. So I'm pushing forward the knowledge of shoulder and thoracic outlet imaging. Okay. I'm pushing forward protocols for imaging, for physiotherapy, uh, for doing stuff, even injections. I'm connecting with someone. We are building a center. It's like a pain center for injections around the shoulder. So I'm building a comprehensive shoulder practice in Lebanon. Shoulder, we are calling it cervicobrachial clinic. So he's a neurosurgeon. I'm pairing up
Mm-hmm.
with him. So we are doing a cervicobrachial clinic, looking at entrapment in neuropathies, thoracic outlet syndrome, shoulder issues, elbow issues, wrist issues. So seeing all these cases. We have a hand surgeon as well with us. So building a comprehensive cervicobrachial clinic. It's one of the most dedicated clinics in the country here. So that's my plan for the next 3 to 4 years. Uh, I'm also joining the one of the Lebanon's prestigious colleges. At the level, I'm preparing my file to become an assistant professor. In that, like I'm holding an academic position as well. That's the plan for the next 3 to 4 years, 5 years.
And family, your wife's good. You've got two little girls now. How old are your children?
Yeah. So the very first interview I did with you, Ken, I was single.
Yeah,
Okay.
that's right. I remember that.
And I was single. I didn't have to worry about like a spouse visa or anything else. You don't have to endorse anyone else but me. And then during lockdown, I met a lawyer and I fell in love with Tahani, and we agreed to engage and to marry, but not right away. Like I was supposed to come to Australia, and then when I come back, we do the arrangements and all sorts of stuff.
Mm-hmm.
But we saw how the lockdown is going, and at that time, Ken, we really thought that it's never gonna stop, right? Like, have you had any thought during the lockdown that it's everlasting? It's not like the more like they used to do like a short period of lockdown, then each time they do another lockdown they extend it more and more, and we hear more cases and more stuff. So we had a
Mm-hmm.
crazy idea, let's go together to Australia. Okay, that's good. That's fascinating. It was my idea, actually.
I've met your wife, so I understand. Yeah.
So we had to arrange another visa for the wife, and um she went with me to Australia, and we actually had like a little wedding party.
Mm-hmm.
It's like a very small wedding party in Australia. So it was fascinating, yeah. And we had our like she got pregnant with Maven, our first daughter, in
Mm-hmm.
Australia. She spent 7 to 8 months in Australia while pregnant. We came to Lebanon, we had Maven, then we went back with Maven to the second uh, to the second round of fellowship,
Mm-hmm.
and then she got pregnant with Haven. So that's the name of my other daughter, Haven.
Mm-hmm.
So she got pregnant with Haven. She came as well in the 7th or 8th month of pregnancy. So she had two pregnancies in Australia, and she told me that uh, like the pregnancies went smoothly, and everything was fine, and we really enjoyed the Australian weather, the Australian food. Everything was amazing. Everything was fantastic. The healthcare about pregnant females is very advanced in Australia.
Mm-hmm.
I like that. We learned early on that we have two little girls, and during pregnancy, so we prepared everything, and it was amazing. it was an amazing experience.
Yeah.
Uh, I had to withstand some of the hormonal fluctuations in pregnancy. That's
Yeah.
understandable. And waking up at 4 a.m. in the morning, probably I shouldn't say that, but waking up at 4 a.m. in the morning to come to the morning rounds was the most difficult thing I have ever
Yeah.
have to do because,
Everyone finds that bit of a struggle.
yeah. But now I understood why, Ken. Like now I'm getting all my team at 4 a.m. in the morning as well. So
There you go.
so like I'm copying lots of your stuff. I don't know how that happens, Ken, but I see myself copying lots of your private practice stuff.
Yeah.
So that's something I failed to mention, that I was supposed to like join the military and become a military doctor. Then, because of the war, I shifted to private practice, and with private practice, I'm doing most of my setup and most of my work, most of my rounds, most of my like a team, and even I'm taking some of your decor, like some of your like the chairs you put in,
Yeah,
like
really?
I copied. Yeah, yeah, of course, I copied some
I'll have to come visit you. All right.
of course,
Wonderful. All right.
100%. Like if war is not ongoing right now, I would have already sent you an invitation long ago, not now. So whenever things settle a bit, I will invite you, of course.
You're still getting airstrikes in Lebanon, aren't you?
They are, yeah, they have been saying that the airstrikes will stop for the past 40 years. I don't know if they are gonna
Yeah, right.
stop ever, but that's how, like it's an area of ongoing political and like Syria, Lebanon, Israel, and uh, the area here is very like is on hot fire, and it's aggravated by religious backgrounds. So wherever there are religious backgrounds to conflicts, they will never end, Ken. They will not, because religion will never end, right? So
Yep.
they will never end. There will always be wars. There will always be conflicts. They are speaking about a peace treaty right now. I hope they sign some. I hope they sign something lasting, something lasting, and this area deserves to come to a peace, right? I mean,
Sure does.
it deserves to come to
Sure
a
does.
peace.
Well, Joma, it's just so good to catch up with you. You know, you, like so many of my fellows, have gone back and become superstars in your own country, and it's just fantastic to see. It is such a joy. And just throw something out to you. There might be a little reunion back in Australia next year for a wedding. So thank you, Joma. So good to see you.
Yours?
Yes.
Amazing.
Yeah.
That's amazing. That's
Yeah.
a good news. I'm really happy for you, Ken. We will attend for sure.
So I'll end it on that. So, Joma, thank you. So good to see you. So that's Inside the Shoulder with Dr. Mohammad Jomaa. Thank you for listening. If you enjoyed that conversation, considering liking and subscribing on your favorite podcast platform. And of course, consider subscribing to Kenneth Cutbush YouTube channel. Thank you for listening.